Hi, everyone. I've been asked to, again, go over filling out the Workman's Comp DWC form. It is super important that this DWC form is filled out correctly for the insurance companies as well as the patient. I need to go over this at the request of upper management so everybody understands how this form should be filled out. I'm going to give an example of an elderly patient. I say elderly, I'm sorry. An older patient that's 65, works at Publix. He's retired, and he was helping somebody with their groceries, and he lifted a bag he thought was potato chips, and it was actually a turkey, and he felt something in his back, and his back hurt him. He let his manager know, and now they sent him to Helix. So the top part of this form, when you go to web mode and merge it, all the information should show up here. Make sure that the date of the accident shows up, and if they're coming in today, make sure that that's there. Again, that should be the front desk, not the provider, but I need to let you know that. So based on what this patient says, yes, I believe this is work-related, so we're going to want to check the work-related box. This is where we're having a lot of problem, is box number 11. Has the patient been determined to have objective relevant medical findings? This means you are seeing it with your eyes, or you have a ER report and CAT scan reports in front of you that are objective. If a patient comes in and says, it hurts when I do this, this is no. Do not worry that we're not going to get paid as an office. We are going to get paid for seeing this workman's comp patient. And also the patient may be paid, but you have to answer this correctly. If they just have pain in their back when they move and they're telling you that, then they do not have any objective findings. So the answer is going to be no. If this guy pulled his back and then fell backward and hit the back of his head and cut it open, then it would be yes, because he's going to have a laceration to the occipital scalp, and then it would be yes. Undetermined, I kind of gave that example on a patient that stated she had problems from 6 months ago and had positive MRI findings or something, but we don't know if potentially this patient, if it was accurate or not. So that's when you would use that. Mainly, I only use yes or no. So I think that that's the appropriate things that we should use in this. Diagnoses, again, make sure the diagnosis here matches the diagnosis on your note. Here's another sticky one. Is there a pre-existing condition contributing to this medical disorder? You don't know. I mean, we're generalists with this back pain. This guy fills it out and he's already got a herniated disc. He also has a lumbar fusion. So I check the box undetermined if there's a pre-existing. I don't know that. If this has to go a long way out and you refer this patient to an orthopedic doctor, let them make that determination. We don't need to make that. So you can put undetermined. Again, is there any finding here that could be a temporary worsening or an aggravation or progressing of a pre-existing condition? We just reviewed a chart, what I say we, our billing just reviewed a chart. A patient had an artificial hip and they were complaining of hip pain. And this was checked no, this was checked no, and there was no comorbidities. This was checked no. All of these, this should have been yes, there's a pre-existing condition. I don't know if it's an aggravation or exacerbation. I would put undetermined. And are there other comorbidities? Yes. If a patient comes in and they fell and they have a history of epilepsy, how do we know that they did not seize? Again, you need to put yes in this. If everything you believe is true, hit yes, yes, yes. If you don't believe your patient, then hit no on these. But these top ones here are the biggest problem that we're having patients filling out, and they don't make sense when you look at the patient's chart. The next section, section 2, If a patient slices his hand, he's the chef, and he sliced off and avulsed his finger, then this would be a key issue. If a patient has a BMI of 44 and they have to go out and collect the carts at Publix and their back is hurting, maybe they're deconditioned. You may want to check number 15. Those are the main things that I put here. Now, you could have a patient that's completely far off, that what they're stating is wrong doesn't match physical findings. And again, this goes into pain, somatic issues. In here, we should not be co-managing and referring a patient. We have come across a lot of these. If you've seen a patient 4 times and they are malingering and they're not getting better, send them, even though the MRI is negative, they've done physical therapy and their pain has only improved 5%. At the 4th visit, one would hope you transfer care to an orthopedic surgeon and let them make the decision if this patient needs to be MMI'd. If you feel uncomfortable and so forth with MMIing them at 0, then transfer them. At this point, if an MRI is negative, patients still complaining of somatic pain, 9 chances out of 10, they may have an attorney. Just transfer them to orthopedics, let them make the decision. We should not be co-managing a patient. We just came across a patient that has been in our office for 6 months being managed, and we should not be doing that, even though they had an orthopedic surgeon and their complaints are orthopedic. Going down further, and again, this is self-explanatory physical therapy. We all know when we check the physical therapy box in our progress note, we need to put in a referral through the inside of there. And the referral just means it's a prescription. It prints out, we fax it to the adjuster, and that referral gets put. Yes, I already know the adjusters take forever, but this is what we need to do, and the front desk needs to do, is to follow up with these adjusters and let them know that the referral to physical therapy went there. As well, we should be giving the patient the phone number to their adjuster. Sorry about that. And again, if we do anything in the office, we sew them up. If we give them a boot, we give them anything, all this stuff needs to be put in. So here we go on this. No one should be marking 22. Putting the patient out of work. We are coming across that. Unless the patient is completely incapacitated, if they're going to sit on the couch, they can sit in a chair and stamp envelopes. If a job does not have a job for them, let them send them home. Don't make that decision. So the next thing would be, if you're gonna, they don't have a problem, you're going to put that, sorry, the phone call got me all confused. You're going to have to put the date there. If they're fine, they can go back to work, no problem. And again, this is self-explanatory. Everybody's doing this pretty good, not having a problem. Body part, etc. You fill out that. I like, some people put zeros in here. I put in a void. I've had people say, well, what does that mean to avoid it? So this hasn't been a real big problem. But put whatever you want, but make sure that you have some restrictions and put them in there. If the job can't find anything to meet those restrictions, let them send the patient home. Now, the last part of this, the only time we're going to MMI somebody is if it's 0. They're 100% better, they feel fine, even if they're 90 and there's really nothing there, like I have a lacerated finger and then the skin is still not completely there and they say they're 90% better, I still MMI them. You're going to put 0, going to put today's date, and they should have no dysfunction. If you are transferring the patient, this is where you're going to want to put future medical care. Sometimes I type into this after MRI, or I'll type after 2 weeks of physical therapy, but still the patient should have a follow-up date, and the front desk should write on here what the date of that appointment is, because insurers want to make sure that the patient is following a program to get back to 100% efficiency and wellness. So again, please review what I just said. Any questions, please send me an email, Helix Cares email address, Ovis@Helix Cares. Again, I have been asked by management to go over this with everybody to make sure everyone is on the same page.